Some would require a little more. They are giving some tablets which will modulate the ovarian function. Some tablets that they may take every day. Some would say, I'm sure many of us who have that challenge have been told to take metformin. And then we wonder, I'm not diabetic, we don't have diabetes in my family, why am I being asked to take this? It is because it will act on the ovaries to begin to change the pattern the ovaries react to the hormones in the higher centers. That's what we call ovarian modulation. And eventually, the woman begins to ovulate. Sometimes other substances apart from metformin are added. That is another part of the spectrum. Some others would require tablets to be added to these baseline drugs on a monthly or cyclical basis to encourage the ovaries to bring out those eggs. When these tablets are given, the effect needs to be monitored by what we call follicular tracking to make sure that we are trying to make those ovaries bring out eggs and the eggs to mature. Is it actually being effective? Some people will just take Clomid from somewhere and imagine that they'll get pregnant with that. No, it doesn't always work for everybody. That is another part. Another set would need injections to be added to those tablets before the ovaries begin to respond. Some others would need assistance in form of intrauterine insemination. Some others, even where you have injections being added to those tablets, and you have what looks like follicles that should contain eggs on scan. When they eventually ovulate, they have a problem with the quality of the egg or the maturity of the egg, such that getting pregnant spontaneously with that may not be easy. They would require assisted reproduction in terms of IVF. Some others will go through IVF, but they will still have some challenge with maturity of the eggs, such that the eggs need a special culture before they begin to mature and get fertilized. But all in all, more often than not, more than 90% of those with PCOS would be able to respond to one form of treatment or the other. So my sister, if you have been diagnosed with PCOS, maybe you've not tried enough. Sometimes it may be that the PCOS is a bit refractory to drugs. Sometimes you'll be offered some form of endoscopic procedure. We call it laparoscopic ovarian drilling or surgery, which also helps to correct the ovarian abnormality, and then eggs begin to be produced. So it may look like surgery, but it is to correct the ovarian abnormality. More than 90% of patients with PCOS will respond to one form of treatment or the other. But at what point in time patient A will respond may differ from the point in time patient B will respond. Some will say, they said I have PCOS and my sister that had it got pregnant on Clomid. Why do I have to do IVF before I get pregnant? Allah knows. So please, you may need to try, but what is most important is that be sure that you are being attended to by a seasoned expert.
Yes.
A gynecologist, a fertility expert. And somewhere along the line, your prayers may be answered. In addition, I've come across so many patients that had to go through a lot to achieve their first pregnancy. And subsequently, the next pregnancy comes when they never even expected it.
Thank you
comes spontaneously.
Thank you very much, Dr. Bountiis. Thank you, everybody. Subhanallah, what a journey this has been. So I would like everybody to take just one thing, a call to action.
Before we go to call to action, I have one Jala question. I was giving the person a law, but this question is very valid. She says that what's the position of Islam on harvesting eggs to keep? I've had somebody advise me to do that, and I think I saw something and I was like, are we even allowed to do it?
Assalamu alaikum warahmatullahi wabarakatuh. The position of Islam on harvesting eggs to keep. To start with, I am also a student of religious knowledge. I am not a scholar, and I do not have the right to pass Islamic fatwa So please forgive my shortcomings. If you eventually discover that what I am saying is wrong, if it is wrong, it is from me. I take responsibility for that. But as far as I know today, Islam permits harvesting and freezing of female garments. So if you think that you are getting close to a time when the egg reserve would have diminished, it is allowed to go through a process of stimulation and harvesting of the eggs so that they will be frozen for future use. Because if they get exhausted, then you have nothing to fall back on that is halal.
Thank you very much. Thank you for allowing us to see